Hi, all. Thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we are welcomed by Dr. Zeev Neuwirth, who is the author of Beyond the Walls and Reframe Healthcare, as well as the host of Creating a New Healthcare podcast. Thank you so much for being here.
My pleasure.
We had a fantastic interview with you, and our tagline is what's resonating in my head, actually, different perspectives and empowering solutions, which is exactly what you were offering through the frame of humanizing healthcare and creating a system, which shouldn't be something that is a different perspective, but it really is. And to create a system could be the empowering solution that we need to transform healthcare positively. So tell us, what is it that we need to do to create the system? What can, if we're not in a leadership role, which is something that you said is so important about starting, what if we're a provider, a patient? How do we try to take that and make this an empowering solution that we can, be, to use Todd Outen's term and Joshua Judy's term, a ripple of change?
Yeah, I think we have to start to, whoever you are, wherever you are in the system of health and healthcare, you make decisions and you take actions. And I think it's really about awareness. Stephanie and Purv, I was sharing with you that when I talk to people, behind closed doors, whether they be healthcare leaders or providers, or just people who seek healthcare and are using healthcare system, everyone says the same thing when they have to use the system. Thank God there's some amazing things about it, but it is so far off from what we actually need. And the stories are, literally every single talk I give, I get people coming up to me and saying, "Oh my God, I just took my elderly father or mother to see their doctor. I was shocked at how bad the system is, how it's not geared towards seniors." Or I was in that emergency room with my child and I could not believe how bad the system was. This is our reality. And it's almost like a narrative that we keep silent, we keep quiet, and we don't, and I think fundamentally we need to start to insert ourselves into it, no matter what domain we are. I just think there are actions we can all take. The bigger one, and I think we all touched upon this in the podcast, I think we have to change the narrative. I think, we have to accept the fact the healthcare system has some wonderful aspects to it, but it is off kilter. And we need to start to talk about a new healthcare system, not for some distant future, but literally for now. I just don't think people are talking about it enough. I think we need to really rally a new narrative.
Zev, I really love that. I think I would suspect you would say the same, but I don't have a question, but I'll invite you to comment if you like. But I was talking, and I was thinking we need to listen to each other also. And if we start there, then maybe each of us is, as patients, consumers, family members, if we're just able to do that and not just complaining, yeah, sometimes it just winds up feeling like it's negative. But if we can truly talk constructively and listen to each other, that seems like a really good way to start. But it's not a question, but I'd welcome any comments you have before we close.
Yeah, I think there's a different way to go about problem solving, and typically we study the problem, we analyze the problem, we test out solutions to the problem. I would suggest there is a different way, which is the path I've been on, which is to look for the solutions that already exist out there. There are always, there's this approach called positive deviance. It's looking for the people and organizations and situations that are different. Like there's been a lot of news about blue zones, right? Blue zones is an example of positive deviance. Here was a guy who searched the world to see where are people living longer and healthier. And he found a lot of examples of that and learned a lot of lessons which we could adapt. I've been doing the same exact thing for 10 years. I've been scouring the United States of America for examples of healthcare solutions that already exist out there that are much, much better. And we have, as you two both know, we have hundreds and hundreds of those examples. So rather than study the problem and continue, as you point out, for complaining about the problem, I suggest we start to look at those solutions, start to adapt them, and start to scale them. Yeah.
Awesome.
Amazing. Thank you so much. And thanks for being here.
Oh my God. Thank you both.
Love it.
And thank you all for watching. We'll talk to you soon. Bye-bye.